So in inguinal hernia, the child may present with a swelling in the groin. When you do the open surgery, one, you have to cut through the various different tissues in the groin to get to the hernia. So you're cutting the skin, the fatty tissue, the muscle, and then get to the hernia, repair the hernia, and then as you're coming out, you got to repair the muscle, repair the fatty layer, and repair the skin. With the keyhole method instead, we are just going through a scar tissue in the belly button, and then two other very tiny incisions on either side of the tummy, and we go straight to the hernia and repair the hernia from the inside. The other benefit is that you can swing your camera around to the other side and look for a developing hernia on the other side. Not long ago, I had a 6-year-old child who came to me with a hernia on the left side. He also had a hernia repair on the right side about a year before. So his parents were concerned that he's had a second hernia. So basically, I did a hernia operation with laparoscopic method, camera in the tummy, and then I repaired the hernia. So they were concerned, asking why did it happen. We know that hernias in children, when they appear, there is a 15% chance of a hernia appearing on the other side at some other time. So with the keyhole technique, we put a camera inside the tummy, you do the operation on one side, and then you can swing the camera across the other side and check whether there is a hernia developing on the other side. And if there is, then you can repair at the same time, avoiding a second surgery. With the open technique, you know that there's a hernia there, you make a big cut over where the hernia is and repair the hernia, and then you don't know what's happening on the other side. Whereas in the keyhole technique, we can check and making sure that there is no chance of the child coming back at a later stage with a hernia on the other side. Secondly, keyhole surgery also identifies any issues in the inside. So for example, a hernia is stuck, you can look for any injuries to the internal structures. Also in the girls, you can look for injuries or abnormalities in the ovaries, the fallopian tube, or such structures which may come into the hernia. So overall, the benefit of keyhole surgery for inguinal hernia is that you can look for a hernia on the other side. The recovery is faster. The pain that the child has to endure is so much less, and also the scarring is so much less.